Recently, I've been releasing videos documenting the issues I'm having with my tracheostomy tube. It's very difficult to insert the tracheostomy tube, and also I'm having a lot of pain around my tracheostomy stoma site. Many people have been concerned and worried that I mentioned in my video that it takes quite a long time to see my medical provider. Let me provide some insight into that. First of all, I am free at any time to go to my primary care provider. I do not go to see her because I know she can't do anything. She can't do a bronchoscopy. She really can't do anything about my issue, and all she can do is provide a referral to the doctor. The doctor she would most likely tell me to go see is my pulmonologist, or possibly an ear, nose, and throat. But if for my pulmonologist, she's just going to tell me to go see the pulmonologist, or ear, nose, and throat, I'm going to be referred, I can guarantee you, to the exact same clinic I saw 3 years ago. Why? Because it's a huge clinic. I think I stated last time they have about 12 to 15 ear, nose, and throat doctors. That's a mistake. They have 22 ear, nose, and throat doctors. They have a lot of ear, nose, and throat doctors, but as I was told 3 years ago by the head doctor of the ear, nose, and throat clinic, you don't know anything about tracheostomy tubes. Ear, nose, and throat doctors will insert the tracheostomy tube, but everything above the tracheostomy tube, that's ear, nose, and throat. Everything tracheostomy tube and below, that is the pulmonologist. That was the head of the ear, nose, and throat clinic. So I don't feel as though I should even bother going back to that clinic because it seems their doctors don't do anything with tracheostomy tubes. And as a cursory look over the website, there is no doctor that actually has tracheostomy tubes or anything of that nature listed as a specialty. Almost all of them are sinuses, sinusitis, nose polyps, different things, maybe ears, eustachian tubes, different things like that. But really, anybody down with a tracheostomy tube, I could find 0 doctors that specialized in that. And after having been told by the head of the ear, nose, and throat doctor, they don't do that, I don't think it's wise to go back to that clinic. Now going to my pulmonologist, so maybe I should go to my pulmonologist, and he's the one that I'm actually trying to get in to see. This is the issue with seeing my pulmonologist. My pulmonologist is extremely busy. He's in charge of the intensive care units at 2 hospitals. He's in charge of the medical units, so he's extremely busy. He works all the time at the different hospitals, trying to save people, coordinated care. He's a very busy guy, and he only has 4 outpatient appointments a week. Those outpatient appointments are very hard to get. He has people with COPD, he has people with cystic fibrosis, he has people with asthma, he has people with a lot of complicated, complex medical needs that need consistent, urgent follow-up appointments. And unfortunately, with my tracheostomy tube and its issues, it's not considered an urgent deal. Now, if I could not get my tracheostomy tube back into my airway, yes, that would be urgent, but they would just tell me go to the emergency department because that's actually turned from urgent to emergency. So unfortunately, it's about 6 months to see my pulmonologist to get in an appointment with him. He does have a nurse practitioner. It takes about 3 months to see her. I have scheduled an appointment to see her. However, I know there's really nothing she can do. She can just look at my tracheostomy tube from the outside, not going inside. I know she said she cannot do bronchoscopies. I've asked her previously, 3 years ago when I was having issues, she told me she can't do bronchoscopies, but she can put down her recommendations and her suggestions to the doctor. The doctor can look at them, and it can also possibly expedite the process to see the pulmonologist. Either he can just read her notes and decide I need a bronchoscopy, or make a referral based on her notes. So that is my plan, to see the nurse practitioner, see if she can make those suggestions, if that can get rolling, or potentially maybe the pulmonologist wants to see me himself, which won't be for 6 months. Now, I know the pulmonologist really can't do anything because, like I said, I had this issue 3 years ago. I was having pain and he didn't know what was causing it, and that's why he told me to go to ear, nose, and throat. And the ear, nose, and throat was the one that says, oh, we don't deal with those issues. And so that's where I end up traveling quite a distance to see an ear, nose, and throat at a major medical center. Unfortunately, that doctor at the major medical center, she was not the right person to be referred to. I had a little bit of an issue. I called up to the clinic. I explained the issues I was having, and I said, is there a doctor you can refer me to? Now, I was referred to this doctor. but I think she knew and I knew she was not the right doctor. I was referred to the wrong doctor. Ear, nose, and throat is a very wide specialty. You can do the ear, nose, throat. They even do head issues. There's a lot of things you can do, and tracheostomy tubes and that part of the airway was not her specialty. And I'm not sure why I got referred to her. And I think she was confused why I got referred to her. But somehow in getting that referral to that clinic, things got a little askewed. So I ended up seeing the wrong doctor. She told me I can follow up with her, but she was very, very uncomfortable with seeing me. She didn't know a lot about tracheostomy tubes. She said she was happy to change out my tracheostomy tube. She didn't go so far as to say, don't come back if you have a tracheostomy tube complication, but she did say, I would suggest you follow up with your pulmonologist for your tracheostomy tube issues. She didn't exactly say not to come to her, but it was kind of code worded. So that's been an issue. I have not been able to find a doctor who specifically knows about tracheostomy tubes. You might think all ear, nose, and throat doctors know about tracheostomy tubes, and I have found that has not been the case. They will change out your tracheostomy tube, but specifically to look at that area, to understand the complications, and to go from there has been another story. Also, I'm on life support, so many doctors get very, very fearful that I'm on life support. They don't want to deal with life support because now you're bringing in another element to everything. You don't just have a tracheostomy tube, you have a tracheostomy tube attached to a ventilator. And that's where they tend to think you're pulmonology, and then pulmonology says, no, it's ear, nose, and throat. So it's been going back and forth, so I have not been able to find a doctor. I'm hoping in the weeks to come, I am able to find a doctor who's able to help me. It might be a while to see the doctor, and I'm okay with that. I know doctors are busy, and being a new patient, especially being a new patient, I know doctors have very limited space. They need a lot of time to do patient history. And a lot of times doctors just have so many appointments and they just need to do bang, 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 bang appointments and to see their old patients, and they don't have time to see new patients. I am completely understanding about that. I know how much effort and energy it takes to do a new patient. You have to get to know the person's patient history. You have to find out what has been done, what has not been done, what you think needs to be done. And that just takes a lot of time. And so unfortunately, a lot of doctors don't have time to do all that. So they only do a couple new patients either a month or sometimes per quarter. They only see a couple patients per quarter, and then you have to wait. Or as I've recently found out, I found some amazing doctors, but they are not accepting new patients. So that is another hurdle I have to overcome, is you might find the perfect doctor, but he or she is no longer accepting new patients. So it doesn't matter how great the doctor is. If they're not accepting a new patient, you can't go see the doctor. So the search has been on to try to find a doctor, try to find the appropriate doctor, because I do not want to chase around and travel a long distance only to find out it's the wrong doctor and the doctor can't help me, because that's really a waste of my time, a waste of the doctor's time, and it's unproductive. So that's just a little explanation about why it's been so difficult to find a doctor and why the wait time is so long. Currently, I'm waiting to see the pulmonologist, and like I said, he has a lot of patients and he has very, very few appointments. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.